Hi, my name is Christina Lenormand, and this is my nutrition media presentation. So first, let me show you the piece of media that I found. So this is a picture on Instagram that was found by someone called the Binge Nutritionist. So it has the old mindset and the new mindset. In the old mindset, it says that I can only have one serving size of Oreos, even though I don't feel satisfied after eating one serving, and I'm going to end up binging later. The new mindset is that a serving size does not know my body, and I can eat as much as I want until I'm satisfied, and I'll trust myself to enjoy the Oreos, and then I'll move on. I do understand what she is trying to get across when it comes to having a healthy relationship to food. But when considering some of the things that we've talked about throughout this course, there are inherently a lot of reasons why this message may not be beneficial, especially for practitioners and advisors of nutrition to be telling their patients or those seeking that advice. So the first thing I would like to talk about is what we talked about in week 1. That is the Crimson Tide. So remember, the Crimson Tide was that picture of the US and it was covered in red colors in 2010. So that red was showing the high prevalence of obesity and type 2 diabetes in the United States. So doing some further research, the CDC states that the prevalence of obesity is 40% in young adults, 44.8% in middle-aged adults, and 42.8% in those 60 years and older in the US. So basically, 40% or more of people in the United States are obese. And then for type 2 diabetes, 34.5% of the US population is pre-diabetic, and 10.5% is diabetic. So that means that 44.5% of the people in the United States have issues with blood sugar regulation and control. So point 1. Then we're moving on to chapter 6, the hungry brain. So we've learned throughout this course that there are many factors that influence eating. These are both internal and external. So some of the internal factors that help us to develop our food preferences are actually the aromas that we smell when we are in the womb of the foods that our mother's eating, the flavors that we get from the breast milk that we take in, or whether we're having breast milk or formula, and then genetics play a role as well. External factors include how you're raised and parented when it comes to food, your examples your parent give you, social factors, the food that is available to you, and other things like emotional factors, your mood. Are you sad? Are you stressed? Are you bored? That also influence our eating behaviors, because when we're in those states, we want to activate our reward system in our brain, and food can help us do that. So then we also have chapter 8. So in chapter 8 is food and mood, craving, and addiction. So this chapter really discusses that satiety is not a cut and dry concept. It used to be hypothesized that if you have high fat in the blood or high sugar in the blood, you will not crave those things. Your body will be satisfied. But we're beginning to learn that satisfaction does not simply come from a physiological need. There's a lot of other components, as we discussed, internal and external factors. So, for example, when someone is feeling depressed or they struggle with depression, the food that they most crave is high carbohydrate foods, glucose. So the reason that this is because glucose and high carbohydrate foods actually increase 5-HT in your body. And 5-HT is a precursor to the mood stabilizing hormone serotonin. It's also been found that people with depression and low 5-HT could have more cravings of these foods. And this chapter also touches that even chronic stress can affect this. Chronic stress actually increases your cravings for palatable foods, which are foods that are pleasing to us when it comes to taste. And those are usually high salt, high fat, and high sugar or carbohydrate foods. Then in chapter 10, so chapter 10 discusses that eating disorders. And this specific post, even though it's actually targeting those with binge eating disorders, it concerns me for those with binge eating disorders. Those with binge eating disorders have a lack of control around food. So they find themselves binging on very excessive amounts of food. And then after guilt and feeling bad about that and feeling sick, they force themselves to purge. And this creates a cycle within them, and they binge, they purge, they binge, they purge. And this can lead to very serious health complications when it goes on chronically. It is also seen and studied that people who do suffer with bulimia nervosa, that is the clinical term for the binging and purging action, they actually have lower levels of serotonin and 5-HT. And this could help to explain why they have those increased cravings and lack of control around food. So bringing that all together, so we have high levels of obesity, high levels of type 2 diabetes. We know, also, a point I forgot to mention is that we also know that our food regulation, this was in chapter 6, our food regulation actually decreases as we age. So we have a difficult time regulating our food as we age because of our experiences, and when food is appealing, we have a difficult time regulating food. So high levels of obesity and diabetes, we're not very good at regulating our own food. Satisfaction is not just based on physiology and what we need, and there's an emotional component and a biopsychosocial component to food intake. So when looking at that advertisement saying, I can have as many Oreos as I want and I can trust myself to enjoy those Oreos, that's not something you should be advising someone, first off, because we should be looking at serving sizes when it comes to food like Oreos. We should not be over consuming those products. And because of altered emotional states, because of what we've been exposed to, and because of, hormonal levels within our own physiology, we may not be able to trust ourselves around those kind of food, and may not be able to trust our own regulation with those kind of foods. So that is why I do not think that this piece of media is something that we should be encouraging those who struggle with diet and food regulation to look at and use as a piece of advice. Thank you for listening.